Hello everyone. Previously, I made a video about calf implants. It must be somewhere on my website. Among the patients we have calf implants, there's a group of patients that require very special attention. Since their treatment is a little bit different. Who are they? Patients with polio diabetes whose legs are extremely thin. Patients who suffer from polio diabetes. In these patients, the leg is generally very thin beginning from the hip. It is necessary to perform an operation on the upper leg as well, and a few other operations on the lower leg, because it's extremely thin and there's a high level of asymmetry with the other leg. Now, we do something like this with these patients. First of all, there's another problem. Let me tell you about that too. Since the healthy leg become very muscular and extremely developed, since the body always puts the load on that side. This is something that increases the asymmetry. In these cases, we can never make a promise to make the two sides perfectly symmetrical. Of course, this is what we aim for, but it is very difficult to make it perfectly symmetrical. Therefore, it's not over one operation alone. You need to know that. Generally, the first procedure we perform is fat injection on the knee, in the tight section. Taking fat from the belly, waist, and even on from the other leg and injecting it over the entire circumference of the thigh. If it's below the knee, we do something like this. Depending on the thinness of the leg, we put two implements if we can, both inside the outer and inner calf muscle. If the leg is too narrow and atrophied, we put a prosthesis only in the inner calf muscle. When putting in these prostheses, our rule is the prosthesis should be as big as possible, but small enough not to disturb the blood circulation in the leg. So, you need to hit a happy medium. I've never had a problem with any patient. There was an only single case. A patient from outside of Istanbul sent me a photo. He has a large wound about 10 inches in diameter on his leg, all black, necrotic tissue, below the knee. This patient tells me it's been 3 days since the operation and two prostheses were placed in my leg. What do you recommend? He says. I wrote to you a year ago. So I checked the archive a year ago and this patient sent me a photo. He asked what can be done. Polio diabetes case. I recommended a single prosthesis at that time. If a single prosthesis is placed, I said the appearance will recover. Not full symmetry, but it will be better. Later, the patient underwent a surgery in the city where he lived, and they put two prostheses, very large prostheses. Blood circulation in the leg was impaired. There was a necrosis about 10 centimeters in diameter above the prosthesis, meaning the whole tissue died. Now, this case is a very good example. Of course, the blood circulation in the patient's leg should not be disturbed. It's not necessary to squeeze the prosthesis inside like this. In other words, we should not try to fit it in by any means possible. It is crucial to make that decision well. We want to enlarge the leg as much as possible, but of course the blood circulation should not be disturbed. In our surgeries, if the leg is too thin like a stick, we put a medium-sized implant inside a single muscle. It's enough to expand it a little bit. It's no problem if you don't have the perfect symmetry in the first operation. Or let's say we place two prostheses. We were able to put two prostheses. The leg is slightly thickened, but again, full symmetry is not achieved. In this case, we do as follows. The patient waits for 6 to 9 months. Of course, the recovery of these patients takes a very long time. Normally, patients with prosthesis begin walking normally at the end of a week. But now, think about these patients. His leg is already very thin and his muscles are atrophied. The patient's walking is already impaired. He walks bouncing off. He has a limp. On top of that, you put a prosthesis that makes the leg stretch even further. The muscle gets stretched. It takes 2 to 3 weeks for those patients to walk normally. As before, meaning bounce off. So it's a tough job. If the patients take a risk and dares to undergo second or the third surgery, he will be satisfied. And we are going to have a better result that he would be able to go outside. We do something like this in these patients. Let's say we were able to put a prosthesis in the leg. We injected the fat on the upper part of the knee in the thigh section. And I'll tell the patient, Go to your hometown. Don't make a diet. Eat lots of kebabs and pastries so you'll have fat around your belly and waist. So, since the prosthesis we put in the leg, the lower part of the knee will stretch the leg a lot. In this way, the tissues will relax a little and the leg diameter will expand. Because the prosthesis you put will make the leg expand a little bit more in the following months. Like 6 months, 9 months, let it soften and relax. Then, come to me and we'll do something like this. Surgery for a second session. Now, there are two calf muscles in the leg. The one inside is large, the one outside is smaller. Now we take out the smaller prosthesis placed inside the smaller calf and discard it. We remove the large prosthesis from the inner large muscle and insert it into the outer small muscle. In other words, the prosthesis inside the outside, the muscle is enlarged. We also replace the prosthesis in the large inner muscle with a larger one. So we change one prosthesis only. Both of them have grown at the cost of a single prosthesis. We widen the leg a little bit more. We perform a fat injection on the knee again. This is why I tell the patient not to diet. We want the fat in the belly and around the waistline. Because these are the areas that hold the fat the best. This is my idea. Other than that, the thigh section, as I said, if there is a fat taken from the other leg, then that area will also get thinner and there will be more symmetry. We use the fat tissue to thicken the thighs, the upper knee. The prosthesis under the knee is also changed this way. They also get enlarged. Another 6 months passes. The patient probably has seen some results by now. In such cases, 2 sessions are usually enough. Like I said, we don't have an expectation to make it equal inch by inch. We don't have such a goal either. It's enough that it is unnoticeable. There's usually a very dramatic outcome between the initial state and the final state of the patient. The patient comes to us with a leg thin like a stick. At the end of these 2 sessions of surgery, approximately 1.5 years later, when the treatment is completed, the patient will be able to go out easily. No one will notice that. I mean, they need to measure it with a tape measure. These surgeries, as I said, are a little tedious, a little costly, because you undergo 2 surgeries, at least 2 plus 1, 3 prosthetics are used. But you get results. There is one important point here. The doctor must make the right decision on the size of the prosthesis. Like the patient who sent me a message a year later with a photo of the result of the surgery there. If an excessively large prosthesis is placed, things can get ugly this time. That is, the wound can be reopened, the blood circulation of the leg may be impaired, and so on. As I said here, the prosthesis chosen should be as large as possible and at a size that will not disturb the blood circulation. The decision here belongs to your doctor. Unfortunately, this is not something that you can choose. And apart from that, it is necessary to follow up a little closer, because the stitches line may be open in these patients. It gets tight when we place a large prosthesis. We put the prosthesis behind the knee. The stitch line there may get a little stretched. I saw small openings in my own cases, but it usually closes on its own when tended with medical dressing, and it doesn't need any stitches. Other than that, I don't have much to say. Like I mentioned, if the patient takes the risk of such a difficult process and the cost of it all, these surgeries that put a smile on their face, the patient becomes pleased. Also, their lifestyle changes a little. They can wear shorts going out. They can go to the beach. Otherwise, they are disturbed at the beach since they don't want to be seen around with their legs looking like a thin sticks from bottom, beginning from the thighs. So, there's a solution for this. You need to know. There's nothing more I can say. If there's anything here, any subject that you cannot find an answer to, or any question that you might want to ask, call or ask me using the number there on WhatsApp or email me. My only request from you is that when sending an email or asking a question, if you're asking something visual, please send me a photo. For example, if you're asking scars or something like that, can I get results from this surgery? Send me a photo. If I don't see the photo, I won't respond. Also, when waiting for an answer, please be patient because the number of the questions asked are too many. I try to get back to everyone. Please try to write your email address correctly. If it is written wrong, I cannot reach the patient. Thank you for your attention.